Saturday at 12 o'clock, which means it's high time for the health wrap. Good afternoon, Carla Winfrey.
Hey,
Carolyn Zoidberg.
Carol. How you doing, Carolyn? And hello to everybody out there. Here we go again. We know the
I'm good.
coronavirus numbers continue to climb across the country, and we're going to talk about tracking and testing. And in fact, we're going to have a reporter from the Los Angeles Times take the test. And we're going to update you on Farmer Reggie's project with the residents of public housing. And we've got two civil rights giants and humanitarians who passed away in the same day in Atlanta. So there's a lot going on.
It's been a tough week. It really has. And we're all still just trying to figure out how to muddle through this. We just got a report a few moments ago here in South Carolina that the beaches have been closed, meaning that there is no parking by the beach, which means you're not going out on the beach in order to sit on top of each other and continue this surge. I mean, it's been out of control. I've had people emailing me and texting me and saying, they're out of town. They don't want to come back home. It ain't over. I need a T-shirt that says it ain't over.
Yeah. Oh, we've got a hello, good morning from Farmer Reggie. How you
Hi,
doing?
Farmer
Hey,
Reggie. We look forward to
fantastic.
seeing the update. I want to know how some of them tomatoes are coming along.
Oh yes, and then Miss Walker, Miss Benita Walker, First Lady's always on the scene.
Our number one fan. Our number one
Yes.
fan. I've anointed her the number one fan for sure. You talked about the testing piece, and that remains along with obviously face masks, keeping your hands washed, social distancing. And people are getting that you want to be tested to know where you stand, and particularly if you're in a situation where you're living around people who are at high risk. These are some of the lines, though. I'm not sure which city this particular picture came from, but these lines look like this in Florida. They look like this in
Texas.
Arizona,
Mm-hmm.
Texas. I mean, people are in long lines. He's taking a nap there. The line is so long. They're in
Mm-hmm.
long lines waiting to get in and to get tested. But now here is the piece that really kind of just drives you bonkers. They came out with a story this week out of Florida television station down there, did an investigation, and they found that the lab was reporting wrong information. Like they had 100% positivity rate. How does that happen? We know there's not 100% positivity rate. I mean, numbers were all juxtaposed, and I mean, we're talking, as they would say, a hot mess here. So you really want to make sure, best you can, you're dealing with a reputable lab. Doesn't help to get a referral to the place that you're going to get the test. I mean, very disheartening after you wait that long, take a test, and then you're getting 100% positive, and you might not actually be positive.
And you have to wait 14 days. Well, you have to wait for them to call you to tell you, okay, you're negative, positive. But then if they think that you're positive, you got to quarantine for 14 days. So very
Well,
inconvenient.
and that's another issue. The amount of time that it's taken. That's an issue that our friend Mayor Keisha Lance Bottoms in Atlanta raised after she had her initial testing. She's been tested a couple times, and then of course she's like, "Well, I got to wait 14 days, and I still have to go back home and be a mom and a wife and run my household." And so that was a little bit of a challenge. But in the news this week, we almost need the bell, ding ding ding, round one, right? What is going on in Atlanta? Well, you're in Tennessee. We both hang out in Atlanta. I, of course, grew up there, and you were living there for a period of time. What is going on, Carla?
Well, it's K against K, Kemp against Keisha. So Kemp and Bottoms face off in this bitter Georgia mask feud. And it's all over the papers, all over television, all around the world, actually, even to the BBC. So the governor says, well, this is a quote from the other mayor of Savannah, who says Governor Kemp does not give a blank about us. Savannah mayor says after mask decision. And he says, we are going to mask. And if you have a problem we've got something for you. Just like
This,
Mayor
uh,
Lance Bottoms said, we'll see you in court.
yeah, I
So,
mean, the mayor in Savannah, he actually gets credit. He was one of the early ones who said, we're going to make this mandatory. And he said the governor was out of line trying to jump into a young African-American mayor. And he really felt strongly about the position, which is why I think his language is so strong at this point. And then, of course, the governor doesn't go for him. He decides he's going to go for Keisha. I'm taking Keisha. Okay. I don't know where y'all standing in the audience, but I think this is going to come out in her favor. I mean, are we wasting tax dollars and time? Thank you. Doing a lawsuit to keep people from wearing a mask. You got to be kidding me. I'm done.
Well, I think the jurisdiction, because, Georgia, you've got rural and you've got city, and most people that are Hispanic or African American populate the Atlanta area. So, of course, we know that there are higher rates and incidents of COVID-19 with people with pre-existing conditions, people of color, and elderly people. So, I think each jurisdiction should mandate what fits their jurisdiction. You may be
Well,
out in some rural place where people live 2 miles away from each other, and it's a different story.
and that's what they've been saying all along. Let the local district decide. Let the locals decide. I mean, this is, again, I really have no words, because every time I see somebody hooping and hollering about being made to wear a face mask, the one question I want to ask them, Carla, is when you get down to the hospital and the intensive care unit, do you mind giving up your ventilator because you didn't want to wear a face mask, and let that person that tried to do the right thing? There was a teacher in Arizona, and her kids, she passed away from COVID. Her kids said she did everything that she was told to do, and she still contracted it and passed away. But I look at these people hooping and hollering, I don't want you taking my rights. I'm like, can you just sign a release, and we won't bother with the ventilator with you. We'll take it over to somebody else who actually tried to comply and look out for the well-being of their neighbor. That's my
Well,
thought.
well, and you see these interviews, and I guess we need to start showing some of those of people who actually say, I just did it one time without a mask, or I let someone come to my house that's not usually at my house. But, the mask is nothing is 100% guaranteed, like any medicine that you take, preventive medicine, but your chances are so much greater, less if you wear the mask. So again, do you want a mask or do you want to wear a ventilator?
Yeah. Well, I want you to give up the ventilator if you don't think you needed to wear a mask, because we need the equipment. We need the PPEs. Young people of color with pre-existing conditions are facing an elevated COVID risk. We reported this 10 weeks ago. I love how it's brand new news to some news outlets. That's my old outlet, ABC. But the reality is, if anyone who has a pre-existing condition, okay, it could be heart disease, diabetes, you could have had cancer at some point, you are at a greater risk. I was having a conversation this morning with my brother and sister-in-law, and we were talking about a family friend, and I was just saying, anyone who's under stress is at a greater risk. And so you want to do whatever you can. We've been talking about this. We had Dr. Sherry on just last
Mm-hmm.
week. I mean,
Mm-hmm.
these pre-existing conditions and added stressors are deadly.
And so what they were saying with young people, a lot of them have asthma, chronic bronchitis, and are obese. And so that's why they're seeing more cases with young people. And they said young people are just sicker now than they used to be decades ago. So they looked at the age-adjusted hospitalization rate, the CDC, and it was the highest among, as far as young people, American Indian, Alaska Native, and African Americans, followed by Hispanic young people. So
We're
this is
continuing to talk about healthy eating, exercise, those personal behavior changes we started talking about 10 weeks ago. Those things have got to happen if we're going to survive this. Because what did I tell you a few minutes ago? It ain't over, y'all. It ain't over. We have had some sad news this week that was not COVID related, but when you add to the stressors of everything we're going through, it's so sad for us to hear that people who are very loved in our community have passed on. We think of them as our warriors, our true justice warriors.
absolutely. Every week we bring information about saving your life, and we're committed to helping African Americans and underserved communities dying of COVID and health disparities. But these two gentlemen committed their lives for fighting another disease that kills, racism.
We're
So
talking
Reverend
about
CT,
Vivian, yeah.
yes, Reverend CT Vivian and Congressman John Lewis, both in Atlanta. And it's so sad that both of them passed away the same day. Reverend Vivian early Friday morning. And then there's a picture of me and Reverend Vivian when he got
Look at
his
you,
trumpet
girl.
award.
You, look at you. John,
And
I
then
call him John. I called him, and I tell you, John fought a valiant battle against cancer. And, I call him John because I actually covered his election when he went to Congress. I was a reporter at WSB TV in Atlanta. And what I think, when I think of John, and I think of John in the context of that picture we just showed you, and Hillary can probably get that back for you. I think of him as the people's politician, because doggone it, John would talk to anybody, take a picture with anybody. In this shot, you see everybody from my first employee, Ashley Palmer, to my neighbor's sister, my classmate from high school, Nancy Smith. She and her friend ran into him at the Atlanta airport, and he stopped and took a picture. Antoine, who does commentary on one of the networks, Karen, who runs a foundation. He loved people and he fought for people. And I see the future senator up there in the corner, Jamie Harrison. I'm sorry, we don't do politics, right? But the point is, he was the people's politician. Everybody loved John. I knew John on more of a social level. And I kind of smiled when I saw your text last night, because, his wife preceded him in death, Lillian, and she was a lovely, lovely sister. And Lillian was a dear friend of one of my buddies, Kiki Thomas. And so this morning I laughed and I said, they all having a good old time up in heaven. John is reconnected with Lillian and Kiki, and honey, that gave me some comfort to know that he has gone on to a better place.
Yes. And there's such a national connection because both of them were students in the 60s at the American Baptist Theological Seminary, which is now known as the college. And so that's where a lot of the sit-ins, the freedom riders, for both of them, those experiences occurred. And I remember when I interviewed John Lewis, once I asked him, I said, what was in that backpack when you went over the Edmund Pettus Bridge, that time, that fateful day, the Bloody Sunday? Because he says, no one has ever asked me that. And he said it was some fruit, toothpaste, and some books, because he figured that he was going to end up going to jail.
We've heard the jail stories. I love Congressman Clyburn's. That's how he met his wife. And they met in jail because she was willing to share the sandwich with him. Miss Emily, we love Miss Emily and miss her dearly, but we've lost a lot of folks this year, and we will certainly miss those gentlemen and their contribution to social and human justice. We'll be back after these remarks.
South Carolinians are asking, what can they do to stop the spread of COVID-19? Our response? Answer the call. Through what's called contact tracing, DHEC's trained contact tracers call everyone who has tested positive for COVID-19 and those who could have been exposed. All information is confidential, voluntary, and collected over the phone. This information helps us protect you, your loved ones, and your community. Answer the call to keep your community safe. Visit scdhec.gov/COVID-19.
Welcome back. Our friends at DHEC trying to educate people about what happens in the tracking and tracing world. We actually even put out a Facebook poll because we wanted to know, Carla, how many people have been tested.
Yes.
I was actually surprised. I only have a pool of about 5,000 friends here. And in that pool, several folks, multiple times, I even asked, and me nosy, why you take it 3 times? One woman told me that her husband is a pastor, and they've got the church doors still open, and that they felt like, they needed to be responsible, and all 3 were negative. That's Chris Goodwin, and she said, the glory be to God. Lots of people, though, taking it multiple times, Carla.
Yes, I know my sister-in-law, Natasha, she had to take it a couple of times because she had some surgery, and she said it was a little uncomfortable, but now they have tests because, they stick the swab all the way in the nasal cavity. But now she said they don't do that anymore. And it seems like there are a lot of different tests out there because our Hillary, our graphics director, she had told me that 2 people in her family had the test, and that there are 4 different ways that you can now take the test. So what we decided to do is to find someone who's taken the test, who is a journalist, and we saw something of a Los Angeles Times reporter. So here's his story.
As all photojournalists out and about these days, we're still on the streets and going about documenting life and all that entails during this pandemic. And unfortunately, that's one of the risks in this job, is that we might get sick. I started feeling sick last week. Not much of a chest cold so much as I was getting headaches and really exhausted and needing to sleep a lot, and in particular during the day. I'm not a napper, and it started coming on strong where I could not go without putting my head down for a while. And there are a lot of cones. I decided to get a test, so I went online and answered the questions and was able to get an appointment for today. So that was last Friday. I was able to get the appointment.
You're going to go ahead and cough into your elbow forcefully 3 times. After that, we're going to get your cotton swab on the inside of your right cheek, inside of your left cheek, roof of mouth, vigorously for 20 to 30 seconds. Okay? After that, get the cotton swab, put it inside the vial, put the vial inside the small bag inside the big bag, zip it up, and drop it up at the end, okay?
Okay. How long before we get results? How long before results?
Around 27 hours to a week. So it kind of takes a while.
Now we got full lab suit.
You're going to do it in your car up ahead, and then there's a bin at the very end and you're going to place it in after. He's going to direct you which way.
Gotcha. Thank you. So, I need to cough in my arm. Ooh, makes me want to vomit. Oh, try not to vomit. Woo! In a bag. In a bag. Woo! And now, in the bag. They had told me 27 hours to 7 days, and it took exactly 7 days. I got my results back this morning via email at 8 a.m. and my results were negative. So I'm very happy to get that result. It was a little stressful this past week. Stayed as isolated as I could and tried my best to keep my wife and kid from getting sick. And now I am on the mend and ready to get back to work.
Special thanks to Jay for doing that. You know, as a reporter, I got so many questions, Carla. And I want a doctor to look at that tape and probably answer some of our questions, because it makes you wonder, could he have had it when he had those symptoms? One of them, similar to Mayor Keisha's husband, slept a lot. That's what we're hearing a lot. And could it have, by the time he got the results in 7 days, it just kind of died down? Lots of questions. But we got somebody today who can maybe help us with some of those questions, because assume he had tested positive. Then comes in what they call tracing and tracking. And we've got a really great person with us this morning, Garcia Williams, who is joining us. Hello, Garcia.
Good morning, ladies. How
How
are
are
you?
you doing?
I'm doing well,
Doing
thank you.
great,
Good.
doing great. Garcia is a longtime friend, but is in the healthcare space. She and I have worked together for a number of years with the National Conference on Health Disparities. And recently I saw where you actually had completed a course through Johns Hopkins in Maryland to be certified as a tracer tracker. Tell us about that and what that means.
Well, it was a great opportunity for me to learn more about, some of the matters with this COVID pandemic. And as executive director of the MEDI Community Resource Center, we are a resource to our community. And I thought it would be helpful to better understand what this resource represents. So I signed up through the Johns Hopkins Bloomberg School of Public Health to learn and understand, the complexities of everything that you just talked about. And in doing so, it was really for knowledge on my part, but the back end of it is that anyone who takes the course and is certified becomes eligible for employment opportunities. So it was a twofold mission on my part. But the idea is that the contact tracer's role is so critical to that individual once they have been diagnosed. And I think that's the key, as you said, the time frame from the onset of symptoms to the actual diagnosis. There is a gap now because of the large number of tests that are being conducted. So the results are not coming back as soon as, one would expect them to. But this whole concept behind where you've been, who you've been in contact with, when your symptoms became more prevalent, those are critical questions that need to be answered. And that is the role and responsibility of a contact tracer.
So Garcia, can you walk us through the steps? I know you ask questions, but do you have a form, computer, or tell us what you actually physically do?
Well, I am not actually a contact tracer. I'm certified to be one, but the process that they've outlined in the training says that there's technology that is available to you, and it is a virtual job opportunity. It's not a face-to-face contact. So you're given information relative to those cases, and you have to reach out to them within a specified period of time. And in doing so, you do have a series of questions. And the primary one is to track where you've been. And what they encourage the tracer to do is to have the individual go back to their social media page, their phone, text strings, because most often, if we had to think about it, it's like, well, where were you 2 weeks ago and who did you come in contact with? So you will pull out that phone and kind of go through the battery of questions and determine that. So the key, first of all, is where have you been? Who have you been in contact with? And of course, your living situation in terms of isolation and quarantine. And I loved it in the previous segment with the reporter from the LA Times, where he talked about trying to isolate as much as possible in that time frame before you get the results back. Each of these steps are important. So for me, as I share it with family members and colleagues in terms of how to guard your space, you have to be aware of who you're in contact with and try to determine who they may have been in contact with. That's to me, the most questionable point of how you can trace those that may have been impacted or those that could have potentially impacted you.
How do they prepare you, Garcia, because I imagine to some extent you're a little bit of a counselor because you're dealing with folks after they've learned that it's positive. And, he talked about in the piece, Jay talked about being very stressed in terms of, getting it, having it being contagious and his family contracting it as well. But how do they prepare you to kind of counsel? You call me and you're telling me you're tracing and tracking because I'm now positive. What component of the counseling comes involved?
Well, and it's really interesting because, and I took, again, the Johns Hopkins Bloomberg School of Public Health, their course, and there are a variety of those that are being offered, and I've seen some recently, but the fact of Johns Hopkins, to me, that brings a large measure of credibility to the process. And they have video samples and encourage you to, use effective communications tools and techniques, a variety of different questions. But the most important one is to establish that rapport from the very beginning. So when you are getting that call, you don't want to be matter-of-factly about it. You don't want to position yourself like, I know exactly how you feel. No, because you really don't, but you're really more so supporting them in this process. The other factor comes into play is confidentiality and private information, because there's certain things that you really don't need to know. So you don't want to put that person on the spot and make them feel as if they are sharing, beyond the need of what this tracer process is to be, for them in terms of their recovery. But they do provide video examples. There are tests that you go through, milestone tests at the end of each module. And theoretically, it should take about 7 days if you are compartmentalizing it over that 7-day period. Of course, in my case, I was juggling so many other things, but the time frame is manageable, and the information and the process that they use to deliver the training, I think, is very well done in the case of the example that I took with Johns Hopkins.
Well, Garcia,
our community is blessed. Yeah, go ahead. Go ahead, Carla.
thank you so much for joining us, Garcia Williams. And we're going to check back in with you in a couple of months and see what's going on.
I'd be glad to come back with you as well. You guys, thank you so much for the work that you're doing.
Thank you.
Thank you. Appreciate you. Talk to you soon.
Okay.
And we'll be right back after another message.
Make sure y'all mask up out there and stay safe, and check out my music, Missing Me, and all my other music on all platforms. 615 exclusive.
That was quick.
Yeah. He went straight to the point.
That
Mask
was a
up.
public service announcement.
Yes, mask up. And that was 615 exclusive, who I did meet when I was out with Farmer Reggie. Last month I introduced you all to him. He's a farmer and also a nurse supervisor at St. Thomas Midtown Hospital here in Nashville. And he donates his time and potted plants for urban gardens for residents in public housing at Napier Homes. So here's an update of Pots of Promise.
And so what we got here, we got butternut squash, beans, watermelon, okra, cucumbers, tomatoes.
So, it's just good to know how to grow your own stuff anyway, just in case something happens.
Unfortunately, the pandemic has brought to light a lot of deficiencies, especially in lower income neighborhoods, a lot of store closures and things along those lines. And so we've seen some deficiencies in food accessibility. We can just get a couple of these youth that are out here today to take some interest in agriculture, and hopefully they can actually make a career out of it. There's several successful and great careers in agriculture, and hopefully we can pique their interest, and they may think about doing that in college.
Well, actually, this tomato is probably a month old or less.
Wow. That big tomato?
Yep, it's a month old or less. Yep, probably less.
Less than a month old?
Yep, and here go our cucumbers. We're going to snake it up, and we're going to bind it up.
How long have they been out there?
They've been out here 2 weeks.
2 weeks.
2 weeks. We done forgot about all this. We'll run to the grocery store. We'll run to these restaurants so quick to eat a meal and pass up a garden.
Well, with the pandemic, one of the main things is really just getting back to growing your own food. With this project I'm working with Mr. Reggie Marshall here, is letting people grow their food, see how the food is grown, offset some costs of buying the food in the grocery store, because of our supply chains. A lot of times now is not readily available.
You have to have these vegetables. We need to get back to life.
Yes, sir. Get a tomato too.
Tomato.
So I can't wait to see the harvest.
Is it motivating you to actually get out there and do a little digging?
Well, actually, I'm too busy trying to tape everything, but, Chef Gabby and my brother Bernice, they have a garden, so I'll have to take him over there so you can see what's going on in theirs. But it's really exciting to see how they even have people driving by that live on the opposite side of the community, and they're giving them plants. It's like drive-through service. It's absolutely wonderful to see how these people really light up, and they're so engaged, and especially the kids that are coming back. They're like, "Oh, you're back." So we're going to keep following and see for that harvest. He said he's going to do some turnip greens in the fall, Carolyn. So I know you like those.
Well, I planted some peppers. I could use my peppers with those turnip greens, Miss Collins, and some Winfrey relish, if you get that in the
raw relish.
We're out of time, but this has been a great Saturday, great show, lots of good information. Thanks to everybody for contributing, because everyone put something into it. But thank you, as always, my sister, for holding it down this week.
Oh, well, hey, that's what we do for each other. We hold it down.
Absolutely. Stay safe, okay?
Stay safe. Stay alive.